How does brain neuroplasticity help after a brain injury? Imagine your brain as a city with many roads connecting different neighborhoods. When part of the city gets damaged, like from an injury or surgery, neuroplasticity is the city's way of rebuilding and rerouting traffic to keep everything moving smoothly. After a brain injury, such as from trauma, stroke, or treatments related to brain cancer, this ability of the brain to change and adapt becomes essential for recovery. It helps the brain find new pathways to regain lost functions like speaking, moving, or thinking clearly. One way neuroplasticity helps is by rewiring neural connections. When some brain cells and their links are damaged, healthy parts of the brain can create new connections or strengthen existing ones. This process allows the brain to take over tasks that were once managed by the injured areas. For example, if the part of the brain responsible for speech is damaged, other regions can adapt to help regain communication skills. At the cellular level, neuroplasticity involves changes like synaptic plasticity, which is when the strength of connections between neurons is adjusted. It also includes dendritic remodeling, where the branches of neurons grow, and axonal sprouting, which is the growth of new nerve fibers. These changes help restore communication pathways that were disrupted by injury, supporting recovery. The brain can also reorganize its larger networks and cortical maps. This means that areas not originally responsible for certain functions can take on new roles to compensate for damaged tissue. For instance, if a part of the brain involved in movement is injured, other regions might adapt to help restore mobility. Rehabilitation therapies play a crucial role in guiding neuroplasticity. Activities like physical therapy, cognitive exercises, or specific movement techniques provide meaningful, repetitive experiences that stimulate the brain to adapt. The more targeted and consistent these experiences are, the better the chances of forming new, healthy connections that support recovery. While neuroplasticity generally promotes healing, it can sometimes lead to maladaptive changes. This might happen if the brain strengthens pathways that reinforce compensatory behaviors, which could limit full recovery. That's why rehabilitation aims to encourage positive, adaptive changes while minimizing any harmful ones. Importantly, neuroplasticity is not just a quick fix. It can continue for months or even years after an injury. This ongoing potential means that consistent practice and therapy can keep improving brain function over time, offering hope for long-term recovery. In the context of brain cancer and brain health, treatments like surgery, radiation, or chemotherapy can cause neurological changes. By harnessing neuroplasticity through personalized cognitive and physical rehabilitation, patients can regain important skills, improve their quality of life, and adapt to the changes caused by their condition and treatment. Overall, neuroplasticity forms the foundation for healing after brain injury. It allows the brain to reorganize, repair, and optimize its functions through experience and targeted therapy. Understanding this remarkable ability guides modern approaches to recovery, emphasizing hope and the power of the brain to adapt, even after significant injury. Always remember, each person's recovery journey is unique, so consulting healthcare professionals is essential for personalized care and support.